Imagine trying to fight a fire inside a locked vault. That's sort of like tackling infections deep inside the brain.
Yeah, a really tough challenge.
But what if you could flood that vault with something essential for fighting the fire? Something like oxygen, but delivered under pressure.
It sounds a bit sci-fi, doesn't it? But it's a real therapy, hyperbaric oxygen therapy, or HBOT, and its roots go way back.
Way back. Centuries, actually. Even before oxygen itself was properly understood.
Which is fascinating. And today we're diving deep into one specific, pretty critical use case, HBOT for intracranial abscesses.
Those pockets of infection inside the brain itself. Now that sounds serious, and well, it is.
Definitely.
But exploring how HBOT fits in here gives you, our listener, a really good insight into how we can use physiology pressure, oxygen therapeutically.
Consider this your efficient way to get up to speed on a complex topic. We've looked through various medical handbooks, textbooks on hyperbaric medicine, spanning decades, really.
To bring you the core ideas without getting totally bogged down in jargon.
So, first things first. What is an intracranial abscess?
Right, let's define our terms.
Essentially, yeah, it's a collection of pus and infection walled off within the brain tissue.
Okay, walled off, but still incredibly dangerous because of where it is.
Exactly. The location is everything. Treatment is tricky. You need therapies that can actually reach it effectively. Standard antibiotics and surgery are staples, but sometimes, well, more is needed.
And things like neuroimaging have helped catch them earlier, which improves outcomes, but it's still a complex fight.
No doubt about it.
Okay, so that's the problem. A serious, hard-to-reach infection. Now, let's properly introduce the potential helper, HBOT. What's the basic idea?
It's actually quite straightforward in principle. The patient is inside a special chamber,
Right.
and they breathe 100% pure oxygen. Crucially, the pressure inside that chamber is increased, usually to, say, 1.5 to 3 times normal atmospheric pressure.
And that pressure is the key.
It is. Because that increased pressure forces much more oxygen to dissolve into the blood plasma, way more than you could get just by breathing oxygen at normal pressure.
So it's like super-oxygenating the blood, basically.
That's a good way to put it. It allows oxygen to reach tissues that might not be getting enough through normal circulation.
And you mentioned this isn't a brand new concept. There's history here.
Oh, absolutely. People were experimenting with pressure for health way back. In the 1600s, Henshaw had his domicilium using compressed air, mind you, not oxygen yet.
Before oxygen was even identified.
Right. He thought changing pressure could help various ailments. Then later, in the 19th century, you had people like Junot in France building actual hyperbaric chambers. They called it a compressed air bath.
Believing it improved circulation. Interesting how the idea evolved. So when someone gets HBOT today, what do these chambers look like?
Well, there are mainly 2 types. You have monoplace chambers. Think of a clear acrylic tube, basically, for one person. It gets pressurized with 100% oxygen directly. And then there are multi-place chambers. These are larger rooms, essentially, that can hold several patients plus maybe medical staff.
Right.
These are pressurized with regular air, and the patients breathe the 100% oxygen through masks or hoods.
But the end goal is the same, significantly boost the oxygen levels in the body.
Precisely. Raising that partial pressure of oxygen, the PO2, throughout the tissues.
All right. So we have the what and a bit of the how. Now for the really crucial question. Why would you use this for a brain abscess? What's the rationale?
Okay, this is where it connects directly to the problems we mentioned earlier. The abscess itself, the inflammation around it, the pus, it all messes with the local blood supply in the brain tissue.
Creates blockages or restricts flow.
Yeah, it leads to areas of poor perfusion and therefore hypoxia, low oxygen.
And that low oxygen.
Yeah.
That's the enemy here.
It's a major obstacle. Because our immune system, particularly cells like neutrophils and macrophages, the bacteria fighters, they need oxygen to work properly. They use oxygen for something called the respiratory burst. It's how they generate reactive oxygen species, ROS. Think of them as like chemical weapons to kill ingested bacteria.
Okay. Oxygen is fuel for their weapons.
Exactly. And the key enzyme in that process, phagosomal oxidase, works best at a certain oxygen level around 40 to 80 millimeters of mercury. That's the partial pressure. If the tissue PO2 drops below that,
their bacteria killing ability plummets.
Significantly hampered, yes. So HBOT, by flooding the area with oxygen, aims to restore that function, give those immune cells the fuel they need.
That makes a lot of sense.
Yeah.
Boost the body's own defenses. Are there other ways HBOT might help?
Another angle is antibiotics. Now, our specific source material doesn't detail HBOT effects on specific brain abscess antibiotics, but there's a general principle.
Okay.
Some antimicrobial drugs, especially those targeting anaerobic bacteria, might actually work better in a higher oxygen environment. Oxygen itself can be toxic to some bacteria, and it might potentiate or boost the effect of certain drugs.
So potentially a double whammy.
Yeah.
Helping our immune cells and making the drugs more effective.
That's the hope. And then there's the direct effect on the bacteria themselves, particularly anaerobes.
The ones that hate oxygen.
Right. The low oxygen core of an abscess is perfect territory for them. Think bacteroids, maybe Clostridia, though not specified for brain abscesses in our sources here. But we know from treating things like gas gangrene.
Caused by Clostridia.
Yes, we know that raising tissue oxygen levels can directly inhibit these anaerobic bugs. For Clostridia, even a PO2 above, say, 60 millimole Hg starts to inhibit their toxin production. Get it up towards 250 millimole Hg, and it can stop them growing.
So by jacking up the oxygen with HBOT, you make the abscess environment much less welcoming for these anaerobes.
Exactly. You're changing the battlefield conditions, making it hostile territory for them.
Okay, so better oxygen delivery, boosting immune cells, maybe helping antibiotics, and hitting anaerobes directly. That's quite a list of potential benefits.
It is. It addresses several key pathophysiological problems in one go.
So what's the actual clinical reality? Does the evidence back this up for intracranial abscesses?
Well, our sources give us a specific pointer, albeit a brief one. The index in the 2008 Handbook of Hyperbaric Medicine lists intracranial abscess, hyperbaric oxygen therapy for children, 105, 106.
Interesting. Specifically mentioning children.
Yes. Now, we don't have pages 105, 106 in front of us, but its inclusion in a major handbook like that, it strongly suggests it's a recognized, documented application, at least within pediatrics.
So it's on the map, medically speaking.
It seems so. And beyond that specific index entry, we also know more broadly that adjunct of HBOT has shown benefits in animal models for various bacterial infections.
Right.
And we can draw parallels from its established uses. Think about refractory osteomyelitis, that's persistent bone infection. Bone can be poorly oxygenated, similar in principle to an abscess area. HBOT helps there by improving oxygenation, boosting immune function, and potentially enhancing antibiotic penetration. Or gas gangrene, as we mentioned. HBOT is a cornerstone of treatment there because of its direct effects on the Clostridia bacteria and their toxins in that hypoxic environment.
So seeing it work in those tough, low-oxygen infection scenarios lends weight to the idea it could work in a brain abscess, too.
Precisely. The underlying principles, overcoming hypoxia, boosting defenses, tackling anaerobes, are very relevant.
Makes sense. But we're talking about the brain, and we're talking about high pressure and high oxygen. Safety's got to be a huge concern, right? What are the risks?
Absolutely. Safety is paramount. And yes, there are potential complications. Probably the most common issue is middle ear barotrauma.
Ear problems from the pressure changes.
Yeah, discomfort, pain, even eardrum issues if the pressure isn't equalized properly during compression or decompression. It happens in a small percentage of treatments, maybe anywhere from less than 1% up to 9%, depending on the study and patient factors.
Okay, that's manageable, presumably.
Generally, yes. Patients are taught techniques like yawning or swallowing autoinsufflation to help equalize pressure. Sometimes ear tubes are needed for patients who really struggle.
What about the oxygen itself? Too much of a good thing.
That's the other main concern, oxygen toxicity. It can affect the central nervous system, CNS, or the lungs.
CNS oxygen toxicity. And it sounds serious. Seizures?
It can cause seizures, yes, but, and this is important, treatment protocols are specifically designed to minimize this risk. They use pressures and exposure times that are generally below the known seizure threshold.
Oh, okay.
CNS toxicity tends to happen at higher pressures than those typically used for infection treatment, and it's usually reversible quite quickly once the high oxygen exposure stops. Pulmonary oxygen toxicity is more related to longer exposures, potentially causing lung irritation.
And claustrophobia.
Yeah.
In those monoplace chambers especially.
That can definitely be an issue for some patients, yeah. Requires careful patient selection and management.
So risks exist, but they seem well understood and managed with protocols.
That's the aim. Careful patient screening, adherence to established protocols, and vigilant monitoring are key.
Where does this leave us now? Is HBOT for brain abscesses standard practice, or is it still evolving? What's the future look like?
It's likely still evolving. That handbook entry suggests it's established, especially perhaps in pediatrics or specific cases, but research surely continues.
For what? better protocols?
Probably optimizing things, like what's the ideal pressure, how many sessions, how frequent? For which specific types of abscesses or patient groups does it offer the biggest benefit?
Right. Fine-tuning the application.
Exactly. And also understanding better how it works together with surgery and antibiotics. That synergy is really important in these complex cases. More research is likely focused on clarifying those interactions.
Okay, so let's try and wrap this up. Key takeaways for our listener.
I'd say the main points are intracranial abscesses create low oxygen environments that hinder healing and immune response.
Right, the hypoxia problem.
HBOT directly tackles this by dramatically increasing oxygen delivery even to poorly perfused areas.
Which then helps the immune cells work better.
Correct. It fuels those neutrophils and macrophages. Plus, it potentially makes the environment hostile to anaerobic bacteria and might even boost certain antibiotics.
And while maybe not first line everywhere, it's a recognized therapy, particularly highlighted for children in at least some literature.
Yes, and the underlying rationale is supported by its success in other hypoxic infectious conditions. But research is likely ongoing to really pin down the specifics for brain abscesses.
It really is fascinating how manipulating something as basic as oxygen and pressure can have such profound effects deep inside the body, even the brain.
It makes you wonder, doesn't it? Thinking about this journey from those early, somewhat crude pressure chambers centuries ago to using hyperbaric oxygen for something as critical as a brain abscess today.
Yeah.
What other seemingly extreme physiological tweaks might hold therapeutic secrets we haven't fully unlocked yet, pushing boundaries of temperature, pressure, gases? It's an interesting thought.
A very interesting thought. Food for further contemplation, for sure.
Hopefully this deep dive gave you a solid understanding of this specific application. If you're keen to learn more, looking into hyperbaric medicine resources or studies on treating severe infections would be the next step.
Absolutely. And that's where we'll leave it for this deep dive. We hope we've managed to shed some light on this complex intersection of pressure, oxygen, and brain infections, and maybe spark some curiosity along the way. Thanks for joining us.